Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our Hospital System General Director. Today is Incident Command Day 52. We're giving you the update from Albany Med on the coronavirus. In the 5 surrounding counties, we have 2,227 people who have tested positive for COVID-19. That continues to be about a 4 or 5% growth increase each day. We often like to remind you that number is people who've tested positive. We don't have the number on how many have recovered. That's not something that's reported, but we know a significant majority of those people have recovered.
Certainly our experience here in the hospital has been a majority have recovered.
Inside here in the medical center, we currently have 57 people who are currently treating for COVID-19. We have 34 on our medical or surgical floors. We have 23 in our ICUs, and the same number on the ventilator as yesterday, that's 6. Today we'd like to talk about how long those people have been on the ventilator. This is a particularly sick group of patients who we're currently caring for, Fred.
Yes, they've been on ventilators, these sick patients, on average about 20 days, which is a long period of time. If you're not a provider, that may not mean anything to you, but 20 days is a long time on a ventilator. Okay. So they're really quite sick. You know, we're doing everything we can to try to get them through this, but you know, things are serious for them.
Okay, and we'll obviously continue to give credit to our incredible doctors and nurses and respiratory therapists who are caring for this particularly sick patient population.
Yes, absolutely. They're doing a great job.
Okay. Any questions for me?
So Dennis, I'm wearing a pin today, AMC Strong from our pheresis group, but
yes,
you have a very colorful, nice shirt on today. Tell us
do.
About it.
So this shirt is for occupational therapy. One of the great things about doing these videos each day is you can actually address issues that went unaddressed the day before.
That's right.
Yesterday I spoke about physical therapy and occupational therapy and communication disorders, and I put them all together. But in point of fact, the work of our occupational therapists is actually very unique and needs to be called out specifically. So this is a group of often master's prepared people, and they work with patients very directly, including our COVID-19 population. They help them on things such as bathing and dressing and getting back to independence, but they also help them with many cognitive skills as well.
That's right. They really help them get back to normal functioning. The things that we all take for granted, paying your bills as an example, is something that they work with them on.
That and how to take medications and independence.
Well, what we call activities of daily living.
Right.
Yeah.
So they're an incredibly important part of our workforce as well. It turns out that it's Occupational Therapy Month, and so we thank all of them and we thank them for their work.
Shout out to them.
For sure. We talk about metrics here, and I was reading last night about some data that was published by the Institute for Health Metrics and Evaluation. And they were reporting out when the peak volume was going to be for COVID-19, both in the country as well as by individual states. And they had mentioned that at a national level, they think that we peaked on April 19th. And they said that actually in New York State, according to their metrics, when you look at hospital beds, ICU beds, and mortality, we peaked about a week or two even prior to that. Which got me to thinking that, Fred, you had mentioned last week about doing some modeling here, both internally as well as with RPI, and I was hoping you could give us an update.
Yes, absolutely, Dennis. So we've been doing internal modeling really on our resource consumption. So medical, surgical beds, ICU beds, and ventilators. And we really have peaked, and in some of those, for ventilators as an example, we have started to come down in terms of the use of those resources. The RPI model that I talked about last week is really focused on the rate of infection in the community. And we know that infection rate is actually a lot higher than the reported cases and dramatically higher than the number of patients in our hospital. So by comparison, you said today we are at 56 patients in the hospital. 57, sorry, and over 2,000 reported cases. But the serology testing that's been performed would suggest that there are over 20,000 cases. So that's the infection rate I think that the RPI model is looking at. But for us, what we're really concerned about is having enough resources to care for our community.
And when you look at our numbers, do you feel confident that we're at a point where we're not going up in an exponential manner anymore?
We're definitely not. So we've peaked, and we've been very slowly declining in our total numbers, and more importantly, there's been a shift to a less sick population in the hospital, away from those vented populations.
So we'll continue to look at the numbers, and we'll continue to bring it back to you as those numbers change. A couple other things from yesterday's video. There was, I think, some comments from people who were due to deliver babies here at the medical center They appreciated the calm way, Fred, in which you described the care of our OB team here. And it's always nice to hear that when we give these updates that provides some calming to the public, and that's nice to hear. There was also a question asked, and so I think I would like to address that. They said, can you give us any advice on caring for our elder parents? And so I reached out to Dr. Andy Coates. He's one of our hospitalists. He has a particular interest in caring for the elder population, and he gave us some advice. He said, why don't you recommend, first of all, that obviously you could go to the store and you could buy the food, but when you drop off the food, please maintain social distancing, wear a mask, and if possible, if things can be wiped them down ahead of time. So that was some good advice, and I think you have some thoughts as well.
And some elders live in multi-generational families, so they're there with their children and perhaps even their grandchildren. So care around the house is important. So wiping down surfaces with either soap and water or alcohol-based solutions, and frankly, even a little social distancing in the home is probably important as well.
It is. And the other advice that Dr. Coates gave was just remind them that it's still very important that they seek the medical care that they need. When people are socially isolated, they can have anxiety or depression, so please reach out to them on a regular basis. And I think that's some great advice as well.
Absolutely is, Dennis.
So thank you for the person who asked that question, and thank you to Dr. Coates for that feedback. On the topic of getting medical care, again, the governor has been talking about how to get non-emergent cases started again. This is a topic we continue to talk about.
So yesterday at the governor's press conference, he talked a little bit differently than he talked last week in terms of the criteria he wants to see in place before elective procedures start. So he sort of increased the threshold. As a result, a number of counties around us that we thought elective procedures could start in are no longer in that category. So really the only county, Dennis, is Saratoga County within our primary care area.
So to be clear, Albany, Rensselaer, Columbia, Schenectady,
Greene,
and Warren,
Cannot under these new criteria. And I think this is a little concerning, and maybe to branch a little bit further into care a little bit more generally, I'm concerned about patients in my discipline, people who have heart attacks. There's data out there suggesting that the number of people seeking care for heart attacks has dropped substantially. So much concern about it that the state even is going to be doing a survey to find out what's been happening. And I serve on a committee that's working on that survey instrument. But it's really important. If you're having chest pain, if you're having abdominal pain, if you're having symptoms that disturb you, you need to seek care. It's very important.
This is an incredibly important topic. I know we're going to continue to talk about it through this week and next week as well as we get more guidance from the governor's office. Finally, the jury's in. The vote is in, and unanimously, Fred, they said my salute was better. But
not surprised.
But
I'm not surprised.
Unanimously, they also say that you're cooler. So I think that
I think it's the mustache.
Must be the mustache.
It's the mustache.
All right, very good. So that'll do it for today. We'll be back again tomorrow. As always, we ask that you please take care of yourself, take care of each other, and we'll see you tomorrow.